think you talked about menopause for sure. That seems to be aligned with disabilities worsening. Pregnancy, of course, is been shown for a number of decades to be better in MS. The ways that it is better are really twofold. One is it's known to reduce relapse rates, particularly in the last trimester. That's when estradiol is very high, by the way. And then after one delivers and estradiol and estrogens drop, of course, you have relapses. And so there's this anti-inflammatory effect of pregnancy. That's great. It's very effective. It was shown by Confavir decades ago that it can be as high as a 70% reduction in relapse rate. That's good. However, the other really interesting thing in addition is that people have shown that multiple pregnancies, so it's called multiparity, having, for example, 3 kids or more compared to 0 or 1, multiparity is protective for disability in the long term. And, when you think about that, it's really interesting because you wouldn't imagine that just the anti-inflammatory effect could do that. We know with our drugs, we have very good drugs now that are anti-inflammatory, and we know that if you're just again, multiparity pregnancy 3 or more 3 times. I mean, having an intermittent anti-inflammatory for 3 times for a period of only months is not going to make you have less disability in 15 years. That's just not the way that it works. And so it really invokes something in addition to this anti-inflammatory effect. And then again, that's the neuroprotective effects. And that's why we studied so extensively the neuroprotective effects of estrogen. And then, of course, a way to maximize them, which would be ER-beta over ER-alpha ligation. There are also data out of Europe, nice data that, progesterones can be remyelinating, estrogens are remyelinating. Probably the two together is what's natural. That's very myelinating. And it would actually make sense, by the way, because a pregnant mother has these hormones and she's got a baby, a fetus, that's trying to myelinate, trying to have a healthy brain development. And so it makes sense that some of these pregnancy hormones would actually be neuroprotective.